Hey girls, it is time for my week 34 pregnancy vlog. I am 34 weeks and 4 days today. And yeah, everything's going well. There is not much to update on as far as symptoms go this week. Everything is pretty much the same. The only thing that's changed here in the last 2 days, I would say, is the fact that I feel less movement, and I have my little calendars back here with Connor and Annabelle. The same exact thing happened at 34 weeks with Connor, and I actually went into labor and delivery to be monitored for less fetal movement at 34 weeks with him. So, and he was fine. I did still call my doctor, and I asked her, that I noticed a reduction in movement. I still felt movement. I used my Doppler. I could still find a heartbeat. It was between 120 and 130, which is her normal. So, I just said, I feel like maybe 2 kicks or 3 kicks every hour instead of almost continuous movements that I was feeling last week. So, they said eat something, lay on your left side for an hour, and you should count at least 6 movements in an hour. So, I was able, after I ate, to feel movements, and it's not that I'm not feeling them, they're just less of them. But my doctor said that that was okay, and I went through the same thing with Connor. So, it worries me a little bit, but I did call the doc, and she didn't seem too concerned, and I don't know, maybe it's just normal. Maybe they start not having room in there. So, but that's the only real change in symptoms this week. I did have my regular OB appointment on Monday, and I had also an ultrasound Monday. She's measuring 5 pounds, 7 ounces, and she was measuring 34 weeks in 1 day. Okay, so according to the due date my doctors have for me, she's measuring 2 days ahead. According to me, she was measuring 1 day behind, I think, or right on. But anyways, she was measuring between 2 and 3 weeks ahead. So she has settled down a little, which I guess is good. So she's in the 65th percentile, which is fine with me. So as long as she's healthy, maybe I won't have such a big baby, maybe just about the same size as Connor. So I did record my labor bag video. It's not edited yet, but it is on my computer. So when I have a minute, I will edit that and upload it. So there's that. And then I guess for the rest of this vlog, I'm going to talk about my visit with my doula, just so I'm not posting like a ton of videos. But we had another prenatal appointment last Friday, and we just kind of went over the birth preferences. I have my birth preferences list over here, and it's just a list of everything. This is a list my doula gave me, so I'm going to kind of read through it as I am talking and just kind of let you know what my preferences are and things like that. But they're just kind of decisions that you have to make, like if you want to labor at home or if you want to go to the hospital when you're in labor. And I would prefer to labor at home as long as I can, assuming that we feel safe being at home, that everything is going well. So we'll labor at home. I'll labor at home. We're hoping to head to the hospital closer to delivery, although depending on the time of day, it can take 20 minutes to get to the hospital, or it can take an hour or more. So it's really going to depend on what time of day things start to get active, and then we will head there. So we're going to try that. When I get admitted to the hospital, And it's good to have this list of things in your head so that when you do meet with your OB, you can talk with them about it. So I met with my doula Friday, my OB Monday, and we did talk about these things. So as far as having an IV, my doctor says I have to have a HEP well or a HEP lock in case they need to give me anything, but I don't have to be hooked up to an IV while I'm in labor. That's mostly if they need to give me blood or something like that because I'm at risk of needing a transfusion. But, you know, there are lots of other things they could have to give me, but I don't have to be hooked up to anything. And then my doc said that I can have clear fluids like Gatorade or apple juice or Sprite, water, ice chips, popsicles, things like that. And then you can kind of decide what kind of monitoring you want. Obviously, I don't want to be continuously monitored, but if I have to be, the hospital I'm delivering at has a unit that it's portable, so you can wear it and be out of bed. So that's good. Things I want in labor, I want to be able to move how I want. Relaxation is going to be important to me. I want probably like my room to have the lights off. I'm taking these Febreze luminaries. I'll have those around me for light. I'm taking 2 of them. Just a dark, quiet, calm environment. Touch might be important. Sometimes I don't like to be touched when I'm in pain, so I'll see when we get there how that goes. You can decide if you want to have limited exams to check for the dilation and things like that. Or you can decide if you don't want to know how dilated you are. I think these are more decisions I'll make at the time as far as that goes. Is natural birth important to me? Yeah. I don't want any narcotics, that is for sure. I just don't want anything like that. I really don't want an epidural because I want the freedom of movement. Probably not that, and I want to be able to feel the pushing because I think it went on far too long last time because I couldn't feel my legs. Like, I couldn't feel anything. And I definitely don't want like Pitocin and things augmenting the labor. That is the probably number one thing I want to avoid because I had Pitocin with my son and his heart rate dropped and I was on oxygen. They kept putting me in different positions and I just don't want to go there. So I do want to use water for relief, pain relief, either in the shower or tub, and we're taking like a heating pad and some things like that too. I want the freedom to push how I would like. My doctor doesn't do episiotomies unless I would want her to. I also don't want people counting to 10 for pushing. I want to spontaneously push. And that is really super important to me because when I had to push 3 times for 10 seconds of contraction, it made me feel nauseous. It made me feel lightheaded because I felt like I needed to take a breath before 10 seconds was up. 10 seconds was just not long enough, or it was too long. I would have rather had like 5 or 6 second pushes, but more than 3 times a contraction. So just to keep the oxygen moving and things like that. And I've been told by my doula that is more natural to push for 5 or 6 seconds multiple times every contraction instead of the 3 standard 10-second pushes, which if you've not given birth, I don't know, maybe it doesn't bother some women, but for me, I didn't like being told how long I had to push. That being said, I do still want to be encouraged when I'm pushing, so I want to be told what's going on, if they can see the baby, if I need to slow down or so I don't tear and things like that. I definitely want some coaching. I just don't want counting. I don't really want a time limit for pushing as long as the baby is doing okay, and I definitely want to delay the cord clamping as long as possible, as long as they'll let me. Ideally, I want to deliver the placenta before they cut it, so we'll see if they will allow that to happen or not. We're going to try to have any of the newborn care done while the baby is with me. If you delay your cord clamping, the baby gets to stay with you, so that's good. So as long as everything's good, that will be the case. We are not getting the Hep B shot in the hospital. It doesn't mean we're not getting it. We're just not going to get it the first or second day of life. I want a nurse in the delivery room before we get moved. I don't want to be induced with Pitocin, but I am all for things to help start labor at home. If we find out she is getting on the larger side, I might do some pumping, and I am going to start taking evening primrose oil at 30. My OB told me I could start taking it at 36 weeks. I'll probably start taking it at 37 weeks. But it's going to help soften like the scar tissue and things I have from tearing last time. So I'm more doing it for that reason, but it can also soften the cervix. So that's kind of like a side effect of that. But I don't want my water broken. Then there are some things for cesarean birth options that we maybe need to discuss a little bit more, but we're hoping that doesn't come to that. So that's the birth preferences list. Those are kind of my preferences and what I want. And yeah, so I talk about this in my labor bag video too, but my doula is bringing a birthing stool to my house and the hospital so I can labor on that and deliver on it if I want. And I did talk to my OB. She's willing to catch on a birthing stool, so that is pretty awesome. And you know, I had to see the other OB in the practice when my doctor went on vacation like a month or so ago. And I asked her, you know, what would you be, if I'm not hooked up to an IV, would you be okay with me drinking water and things like that in the delivery room? And she basically said, no, just ice. So I asked my doctor, I said, if you're not the one to deliver me, and another doctor isn't okay with some things that we've talked about, how can we handle that? Because there are things that are important to me. Like if I don't have IV fluids and I'm not allowed to drink anything, I don't know how long I'm going to be in labor, but that can't be good for me or the baby, and things like that. So she said she's going to give me her cell phone number, and she's going to take call for me. Unless I deliver on Thanksgiving, then she won't. But she's honest about that, right? At least she could lie and say that, and then I could be highly disappointed. So, yeah, barring a few times in days, she will take call for me. So that is pretty awesome. So that's kind of what we talked about with the doula. I actually see her again in a couple weeks. So we'll have one more prenatal and then the delivery, and then we'll have postnatal appointments too. So I will show you the belly, I suppose, and I guess that's it for this week. But if you girls have any questions or comments, leave them below. Alright, so you can see I'm growing out of my clothes, my maternity clothes. You see in the front. Well, I don't think you can see, but that's the belly band of my pants. But there she is. And the front. And the other side. So there she is. In the front there. And the other side. And I actually feel like I look bigger, but I actually lost a pound in the past 2 weeks, so maybe the baby's getting bigger, but I'm not gaining any more weight. So I don't know how all that's working out, but yeah, I think that's it for this week. But thanks for watching, girls. If you have any questions, feel free to ask, and keep your eyes open for some other videos I'll be uploading. Thanks for watching. Bye.